Hello, today we are joined by Mr. Mital Patel. He is joining us from the Barts Health NHS Trust in London. He is sharing his Showcase AF Pioneers report. Thank you, Mr. Patel.
Hello, everyone. Firstly, thank you to the AF Association for presenting me with the AF Association Healthcare Pioneer Award on behalf of Barts Health NHS Trust, the North East London Integrated Care Board, UCL Partners, Clinical Effectiveness Group, University of London, and the East London Cardiovascular Prevention Group. I'm Mital Patel, and I am a specialist cardiovascular disease prevention pharmacist at Barts Health NHS Trust, and I am currently specialising in an integrated primary care role, focusing on atrial fibrillation and anticoagulation. Public Health England has set a national ambition of anticoagulating 90% of patients with atrial fibrillation by 2029. The Centennial Stroke National Audit Programme, which is a national healthcare quality improvement programme on how well we measure stroke care, showed that 27% of patients admitted to hospital within 3 London boroughs of Redbridge, Barking, Dagenham, and Havering showed that those admitted to hospital with stroke and known AF were not on anticoagulation therapy. The Quality and Outcomes Framework, which is an incentive programme for all GP practices in England to deliver good practice, showed that 85% of patients with AF at high risk of stroke were anticoagulated within these 3 London boroughs. Now, this shows that there is still significant room for improvement to meet that national ambition set by Public Health England. And the Fuller Stocktake report showcase that we should be providing proactive, personalised care to patients from an MDT to help patients stay well for longer. And what they very nicely quoted was to ensure that for patients, it's what matters to me rather than not what is the matter to me. Now, with AF-related strokes, we know that if someone suffers an AF stroke, they are at 70% higher chance of hospital mortality, a 40% drop in the chances of being discharged directly back to home, so rather being discharged into further rehab care, and there's a 20% increase in their length of hospital stay. So because of this, we developed a pathway to where a specialist cardiovascular pharmacist was commissioned to identify these high-risk AF patients by working with primary care clinicians, specifically GPs and primary care pharmacists. We utilized proactive care frameworks, which were developed by UCL Partners and the Clinical Effectiveness Group, which allowed the specialist pharmacist to stratify and prioritize patients for review. Those who are not on oral anticoagulation were deemed to be at highest risk and were urgently reviewed for potential initiation of anticoagulation where suitable. GPs and primary care pharmacists were coached to initiate anticoagulation in primary care, avoiding delays in initiation, which were historically referred to secondary care for initiation. Patients on dual antithrombotic therapies, so on oral anticoagulants and antiplatelets, were also assessed to determine if their antiplatelet therapy could be stopped to minimize their risk of major bleeding. Any complicated patients were referred to a virtual multidisciplinary team on a weekly basis, which consisted of a consultant cardiologist, a consultant hematologist, a GP with specialist interest in cardiology, and a specialist pharmacist to review these complicated patients and to agree an action plan, again, rather than referring back into secondary care. These patients, once reviewed, were, like I mentioned, reviewed for initiation of anticoagulation through primary care rather than referring onwards to secondary care. So what we've shown is at baseline, which is around December 2020, approximately 88% of patients within these 3 London boroughs with a CHA2DS2-VASc greater than 2 were anticoagulated. By March 2023, we showed a significant improvement in anticoagulation rates, going from 88% to 94%, an improvement of approximately 6%. A total of 1,579 patients were reviewed by a specialist pharmacist between December 2020 and March 2023, with 415 patients being initiated on anticoagulation, an improvement from 88 to 94%. This has translated to approximately 17 strokes prevented. There was also a reduction in the number of patients on dual antithrombotic therapy from 592 patients to 282 patients, a 52% reduction. And again, this is estimated to prevent approximately 3 major bleeds, improving patient safety. This was all a combination of the specialist cardiovascular pharmacist reviews, increased training of GPs and pharmacists in primary care, as well as the availability of the MDT to appropriately review and initiate anticoagulation in the community. So in summary, what this program has shown is that a specialist cardiovascular pharmacist integrated into this system-wide multidisciplinary team has contributed to a significant improvement in anticoagulation rates across these 3 boroughs, reducing that risk of stroke to patients, but also stopping inappropriate antiplatelet therapy to reduce the risk of bleeding in these group of patients. By extrapolating this model nationally, approximately 3,600 strokes can be averted over a period of 18 months. Once again, I would like to thank the AF Association for this award and the opportunity to showcase this work. Thank you.
So thank you, Mr. Patel, for that very good presentation, very informative and very helpful. Thank you. I've just got a couple of questions to ask you about the case study, if that's okay. Sure. One of the questions is, how important is it that doctors engage with pharmacists with the detection of AF?
I think it's very important that we get as much as engagement across not only doctors, but the wider multidisciplinary team. By bringing in our specialist knowledge from a specialist centre, we're able to provide this specialist advice and guidance at a much quicker rate rather than them being referred into secondary care. So I think embracing that multidisciplinary culture can help improve safety for our patients, especially with AF and stroke reduction.
Thank you. The other question, final question. The AF Association has been promoting this case study and we are launching this webinar. What more can we do to encourage GPs, pharmacists and multidisciplinary teams to collaborate and reduce the number of AF-related strokes by increasing the detection of AF?
I think using as many opportunities as possible. So I believe there's the sayings which says make every contact count. So whether it is any appointment, any public health awareness that the AF Association may be doing, if there is any contact that we have with patients, whether it is something like an opportunistic pulse check, embracing the new technologies that we have available to patients as well, can significantly help improve detection of AF for our patients.
Thank you. And thank you for your time today. Thank you, Mr. Patel.
Thank you very much.